MRSA, a video presentation by William, Robert and Paul. MRSA is an abbreviation for methicillin-resistant Staphylococcus aureus, which is a bacterium which results in multiple types of infections. It is a strain of Staphylococcus aureus which is resistant to beta-lactam antibiotics, which mainly include penicillin such as methicillin, oxacillin and nafcillin. This strain has developed by natural selection by prolonged use of these antibiotics where mutagens have come about. This bacterium is often found on invasive medical devices, open wounds, and in people with weakened immune systems, meaning that facilities which contain a large number of people, such as hospitals and prisons, are at higher risk than the general public, although cases outside these facilities have been recorded. There are a number of antibiotics which have been available over the past 50 years that are used to treat MRSA, such as vancomycin and rifampicin. The drug that we've decided to talk about is Zyvox, which is the brand name for linezolid. Linezolid is a member of the oxazolidone class, which is a compound that contains 2-oxazolidone within its structure. The drug is active against most gram-positive bacteria, which includes streptococci, vancomycin-resistant enterococci, and MRSA. Since linezolid is a protein synthesis inhibitor, it stops the growth of bacteria by disrupting the production of proteins, making it a bacteriostatic agent rather than a bactericidal. It does this by binding to bacterial 23S ribosome RNA and stops the production of the 70S initiation complex. Linezolid is administered one of two ways, either orally as a 600mg dose or as intravenous as a 200mg per 100mg dose. It has a bioavailability of 100%, meaning that none of the drug is metabolized when administered orally. Even though the bioavailability is high, protein binding is relatively low, at only 31%, meaning that the drug's efficiency may be affected by the degree in which it binds to the proteins within blood plasma. The properties of linezolid include 5 hydrogen bonding receptors shown in red, 1 hydrogen bond donor shown in blue, a molecular weight of 337.346 daltons, and a log p-value of 0.9. These properties also include a water solubility of 3 mg per milliliter, polar surface area of 71.11 angstroms, oral table bonds, a pKa value of 14.45 at its strongest acidic form, and a pKa value of -0.66 at its strongest basic form. Not only does it have all these properties, but also obeys the Pinsky's rule of 5, which is one of the reasons why it is so commonly used as a treatment for MRSA. Linezolid, once absorbed, reaches its max plasma concentration after 1 to 2 hours. The half-life of the bacteriostatic agent is between 4.5 and 5.5 hours and is expected to be fully excreted by urination within 12 hours of administration. This makes it easy for the patient to have the drugs administered, as administration is only required twice daily. There aren't many side effects of the drug, and as with all pharmaceuticals, it has undergone intensive clinical trials which indicated that acute toxicity can lead to increased activity, ataxia, vomiting, and tremors. Thanks for watching, and we hope you enjoyed the movie.
Created using Powtoon.